Hi, welcome back to Everyday Behavior. My name is Dr. Marianne Shepard, and in this video, we are talking about when should you seek out services in the school setting. So as a teacher, when should you refer a student, or as a parent, when should you request a referral for services in the school setting? And so we're talking about anywhere from pre-K up. And so when should you seek a speech therapy referral? So the first thing we want to talk about before we even talk about the referral is whether you need a school-based or an outpatient referral. So your child can access services for speech therapy, physical therapy, or occupational therapy in either the school setting or the outpatient setting or both. And so it may be applicable or it may be appropriate for your child to receive both services in the school and services in an outpatient setting. So what does school-based services address? School-based services are only going to address the child's functioning in the school setting as it applies to accessing education. So you would seek a speech therapy referral if their speech language communication concerns were negatively impacting their school performance. And so if it's just a simple articulation problem and it's not negatively impacting their school performance, then they may not qualify. Or if it's an advanced communication skill, it may not be significant enough to qualify for services in the school, but it would qualify for services at home or in the outpatient setting. When you're requesting services through the school, you're going to request, typically in writing, a referral either from your school administrator or the special education department. The referral process is slightly different from district to district and state to state. And so you would want to talk to your school administrator and special education department to determine how do you request a referral for any of your extra services. Early referral concerns in the school setting may include oral expression. So that could be word combinations or their articulation. It could involve oral comprehension. This is what we call receptive skills, understanding what's being said to them. So 2-step or 3-step directions. And it may include written or graphic expression. Written or graphic comprehension. And so the ability to understand letters and signs and symbols or any kind of visual communication. So our communication isn't just auditory or oral, it is also visual. We communicate through a lot of visual things as far as exit signs and yes and no and things like that, like a visual for no. It may also include phonemic awareness. So if the child is not able to produce those phonemes or hear those phonemes or understand those phonemes, those are things like the b, t, k, b. Those are all phonemes. So those individual sounds, if they're having a difficulty with those, it may also impact their pre-literacy and language-based literacy deficits. And so you may also seek a referral for those circumstances. When do you seek an occupational therapy referral? So again, schools start to provide services as early as age 3. Same process for requesting an occupational therapy referral as for a speech therapy referral. You want to talk to your school administrator or special education department. And what are things that you might look for? Again, just like speech, it has to be something that impacts their school performance. And so if they're not developing a hand dominance, they're using both their right and their left hand interchangeably, and they're not really developing that strength with one hand or the other, that could be something that a speech therapist or an occupational therapist could assist with. If they're having trouble with that tripod grip, maybe they're still using a fist to color with, and they're not really using what we call a tripod grip, which is the 3 fingers in a tripod to grip, then that is something that we would want to intervene with an occupational therapy referral. If they're having a hard time crossing the midline or coordinating movements across the body, that bilateral coordination, that would be something that would be important for occupational therapy. At lunch or just in the classroom, if they can't use their little hands to open packages or to, access things that they need in the classroom, like opening their lunchbox or their school box, unzipping their pencil bag or their backpack, that would need an occupational therapy referral. If they can't button or unbutton their pants in order to go to the bathroom independently, that would be something that an occupational therapist could help with in the school. If they're overstimulated by noises, maybe this is the lunchroom, recess, PE, or just free time or less structured times in the classroom, an occupational therapist can help with that sensory environment. So those are all reasons that you may request an occupational therapy referral in the school setting. What about when to seek a physical therapy referral? Same things apply here. So if there are physical limitations that are preventing engagement in education, then you're going to want to request that physical therapy referral. And so school-based PT is there to help modify the environment to maximize their participation. So making sure that they have a seat that they can sit in that maybe accounts for any core deficits that weakness that they might have. The physical therapist can also help in altering expectations to maximize success and independence. So maybe that's in physical education, or maybe that's in doing their assignments in the classroom. It also helps to provide education to the staff on how they can implement things on a daily basis to enhance that physical participation. When PT is appropriate is when a child cannot safely or independently navigate through the school environment. So that's getting into the school, going down the halls in the school, in the cafeteria at the school, wherever that is, any kind of school environment, learning to navigate through that environment. Or if a child has trouble sitting in their classroom chair, or sitting on the floor, or accessing the instructional setting, that again would be a time where a physical therapist could come in and provide some assistance. But it may be that your child has more deficits that are impacting their overall development that wouldn't meet that requirement for this school. And so in those circumstances, you may also need a referral for outpatient physical therapy from your pediatrician. I hope that this has helped to explain maybe the difference between outpatient and school-based services, and also when you should ask for a school-based referral versus an outpatient referral. Please visit our website at everydaybehaviors.com. Also, I encourage you to subscribe below by hitting that red button, or to like us on Facebook to receive additional information on future resources. Thank you and have a wonderful day.